Senhor Deus, obrigado por este dia, por este local.
Roberto Kikawa's working day starts with a prayer. He compares his profession to religious service. He's a doctor.
Que estará chegando aqui, que sinta a sua presença, a sua unção.
And Brazil is a religious country.
No nome de Jesus. Amém.
Dr. Kikawa doesn't have a posh doctor's office in São Paulo, but travels to where he's needed most with his mobile medical center as part of the CS project. At the moment, he and his colleagues are in São Mateus, a poor district on the outskirts of the city, treating locals in a mobile clinic. This morning, Kikawa will perform 40 gastroscopies, making sure in each case to take plenty of time to get to know the person behind the patient. That approach is central to his project.
They have feelings and a soul, body and spirit, and those things all go together. That's what doctors are there for, to take everything into consideration, not just the illness. If you do that, you're contributing to change, to transformation.
Kikawa would like to shake up Brazil's healthcare system and make it more humane. Here, where people wait months and even years for appointments, his idea is well received. Vanusa Alfredo Pedro de Souza is familiar with the waiting game, but now it's her turn. With very little preamble, she gets to see a specialist who examines her thyroid. People in São Mateus are not used to being treated so well. There are few doctors and no specialists in the densely populated area. Vanusa's husband has felt the absence of medical professionals acutely. In 2010, she says, he slipped a disc and takes out his X-ray pictures to prove it. But he's not been treated for 4 years.
The orthopedic doctor told my husband to go to the neurologist, but there isn't one. I have now registered a complaint, but I was told the examination reports are too old, so now we have to start from the beginning again.
But there is another way, and that is CS, which has the backing of Brazil's state system. The health authorities send people to CS sites and pay for their treatment. The service offered by the organization is a welcome means of helping to shave a couple of months off long waiting times. People have to wait here too, but not for long. They are given appointments and receive their diagnosis immediately.
I think we're reinventing the healthcare system to create one in which both structures and a human approach can be brought together. A well-balanced mix of the medical staff, technology, and organization.
Kikawa was born in Brazil, but raised in the Japanese tradition. He says his work requires both Japanese discipline and Brazilian warmth. Having watched his father fight a losing battle against cancer, he decided to become a doctor and to improve the health system in his birth country. But he says the problem is a global one.
There are
some 7 billion people on this planet. How many of them do you think have access to healthcare? Only 5% of the entire population of the world. And what about the rest?
CS helps 2,500 people every day. The organization now has 25 mobile units, and there are more in the making. The containers earmarked to become high-tech medical centers are not very big. It's essential to make the best use of every centimeter without compromising hygiene requirements. A fully equipped medical truck costs an average of 600,000 euros, which is approximately a tenth of Kikawa's organization's annual budget. Most of his funding comes from the state, but he also receives support from private companies and sponsors who contribute money or technology. Kikawa's latest idea is to put an operating table and an examination room in a single unit. Two-thirds of Brazilians are dependent on the state health system. Very few people can afford private health insurance, a luxury some dare not to even dream of. For SIAS to expand, it will take more than just the latest technology and mobile medical centres. The organisation depends on team spirit and a genuine desire to help people, neither of which money can buy. Robert Kikawa knows that the road he has chosen to travel is a tough one, but when he's with his patients, he also knows it's worth the effort.
Tudo certo? Primeira vez? Primeira vez?
É a primeira vez.